Let's take you back to that joint press briefing with President Cyril Ramaphosa, his French counterpart, and the WHO Director General.
Transfer. So this is a phenomenal step, but it is a step that needs to be taken as we move to the realization of what we've proposed, which is the waiver of the TRIPS IP. But we are going to utilize this opportunity. It is a valuable opportunity. It's a technology transfer, it's a knowledge transfer, and it's going to give us the capacity that we need. And we already have BioVac in South Africa that has demonstrated that, yes, it can make vaccines. And this technology transfer is then going to lift our capability to a higher level for our continent. And once we reach a level where we can make our own vaccines, we will be doing so for the people of Africa, because that is where the greatest need is. We've got 1.2 billion people, 60 or 70% of whom are now waiting for vaccines, and only 2% have been vaccinated. And this, for us, is going to give us a real good chance, and we should be able to have these vaccines manufactured as quickly as possible. So it is a great move, it is historic, and we welcome it with both arms.
Many thanks, Your Excellency, for answering this question. We will now move to Simon Anteba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Anteba with Today News Africa in Washington, D.C. And this question goes to President Cyril Ramaphosa of South Africa. Mr. President, South Africa has made more progress than many other countries in Africa when it comes to vaccines. However, with more than 1.8 million cases and almost 60,000 fatalities, South Africa accounts for nearly 40% of all the cases and deaths in Africa. And right now, there is a third wave underway in your country. But looking forward, where do you think South Africa will be by December this year? When may we see the first mRNA vaccine manufactured in South Africa? And what type of mRNA technology transfer assistance do you expect to receive from the United States? Thank you.
Yes, you are absolutely right. We are facing rising infections, and you're absolutely right, with more than 60,000 or almost 60,000 people who have lost their lives. It's at 58,000, a few hundred. So that is a great concern to us. This is the third wave, as I said, which seems to be much more vicious than the earlier waves of infections. We obviously are committed to bringing the infections down, and we continue to pass on the message about all the measures that are important to bring down COVID-19. Social distancing, wearing of masks, washing of hands, and all that the World Health Organization has been beaming to us. We are sending that as messages to our people. Now, vaccines availability is going to be a great boon for us. And that is why we are saying we'd like to receive more and more vaccines. They are sort of coming in short numbers, and we want more and more vaccines, because that is the only defense that we will have against COVID-19. Now, this technology transfer, as I said, is really going to boost our capability to fight COVID-19. We expect that with the wisdom, with the capability that is going to be transferred to us, right from the WHO and the various other partners. I mean, we've got world-class partners who are going to be working with our companies here, and they are committed to giving us the assistance we need, and they're treating this pandemic as an emergency. And when people act, under an emergency, I find that they are able to achieve a great deal. So we expect that a great deal will be achieved. I will not be able to give a time frame of when all this will be possible, but we would like it to happen yesterday. And those who will be working at it, I will go myself and meet them, shake their hands, and tell them that I want this to happen yesterday, not tomorrow. And I think that will fuel them, that will encourage them to realize that we've got to work to defend the people of South Africa, but more importantly, also the people of our African continent. So through this, we will be working to fight the pandemic on the African continent, where we are also seeing rising infections. So this, for us, is really a great moment. It's a historic moment. It's a moment that we want to utilize to good effect, because on the African continent, we've got capabilities. They just need to be ignited. We've got expertise. It just needs to be unlocked. And through this, we are going to unlock it. We're going to utilize it to good effect. Finance will be made available, and we are going to want to work with all the partners involved on this to make this a reality. So we're grateful that we have arrived at this, but we still have a long way to go. We want to see the waiver process happening so that real intellectual property can be transferred. And we've put a time frame to it. We have not said to the great pharma companies and the various other countries, we have not said do it forever. We say do it for a limited time as we are fighting this pandemic. So there is a benefit in doing it to save lives. And we are not even saying we want companies to make profits. We're saying, let us work together to save lives. And this is the beginning of that process.
Many thanks, Mr. President. We will now go to Robin Millar from Agence France Presse. Robin, please unmute yourself.
Thank you. Yes, if I could just ask a bit more about the hub. Perhaps if you could tell us a bit more about just how this hub is going to work and how quickly you'd like to see it get started and fully up to speed. Thank you.
Thank you so much for that question, and it's great to see both President Ramaphosa and President Macron be so enthusiastic about this. I think it's a new approach, a new model, bringing together the private sector, the public sector, investment banks, academics, universities, regulatory agencies, and of course WHO. Trying to facilitate and coordinate all of this. What we hope will happen as a next step will be that we will be looking at the different technologies that are on offer. As you remember, this was a call just for mRNA technologies. And we have several options on the table from mainly from smaller companies and biotechs, though we are also in discussions with the larger companies that have proven mRNA technology. And we're hoping very much that they will come on board. So the timelines of when vaccines can be produced in the country will depend on whether there's a tried and tested technology that can be much more easily transferred to the facility in South Africa, which, by the way, already exists. There's already a pilot plant there. So all we would need is to put in some equipment and then train the workforce there locally on this the new process. Of course, sourcing all the raw materials and things that are going to be needed for this. In that situation, we could even expect to see within 9 to 12 months vaccines being produced in Africa, in South Africa. There are other options, which is to take technologies that are a little bit more upstream, that are earlier in the development pathway. This would, of course, mean that you then have to go through the process of running the phase 2 and 3 clinical trials. Some of these candidates have completed phase 1 and are quite encouraging. But we know that unless you complete clinical trials, you're not really sure about efficacy and safety. So that will take a little longer. But the good thing is South Africa has huge capacity in clinical trials, in R&D, and the regulatory agency there is very much very strong and up to speed with all of the requirements. So that's why I think the hub was selected to be in South Africa, because we had a number of criteria against which the applications were ranked, and certainly on the African continent, this consortium fulfilled many of the criteria that are needed. So I think we would like to take it step by step, and within the next few weeks, we should be able to provide further details on the technology and when the work actually will begin. But obviously, we would try to do it as quickly as possible. Thank you.
Many thanks, Dr. Swaminathan, for providing this clarification. We will go to the next question now. Jérémy Lange from Radio France Internationale. Jérémy.
Thank you, Tarek. Good morning, everyone, or good afternoon. I would like to know, we know that technology transfer usually takes time. So the question is, how historic is the day really when compared to an IP waiver? You said that Africa would be able to produce vaccines within the next 9 to 12 months with this hub. I'd like to know if you had an IP waiver, would it be faster even more? Thank you.
I can start, and maybe others would like to add. I think the IP issue really becomes a barrier when there are patents that are filed in the country. And as far as we know, for mRNA technology, there are no patent IP barriers right now on the African continent and in other LMICs. So we believe that that's not going to be a barrier just now for us to go forward. And one of the partners that we have in this endeavor is a medicines patent pool. They bring their expertise. They've done the landscaping of where there are barriers to mRNA technology. Of course, there are a number of components that go into vaccines, so we would have to do a much more thorough analysis. But we don't believe that currently for the hub planned in South Africa that there's going to be a major barrier. But again, at the same time, we do call upon countries to support the TRIPS waiver, because that could end up delaying things if we had to look at those issues one at a time, even if it's a small ingredient or a component of the vaccine that is blocked by some kind of protection, IP protection. So the TRIPS waiver would facilitate that, would make it smoother, but we don't believe that in this case it's going to be a barrier at all.
Many thanks, Dr. Swaminathan. I understand that His Excellency Cyril Ramaphosa had to leave us, so we will continue this press briefing without him. We also just sent you the press release on the issue that we are discussing today. So next question comes from Kyoto News, and with us is Tomo Deguchi. Tomo, can you please unmute yourself?
Hi, Tarek, can you hear me?
Okay, so we come out of that press briefing so that we can just have enough